In this video, I'm discussing recall history, that is viral induced wheeze. So it repeated. Normally, it come viral induced wheeze, repeated scenario in Egypt, recurrent cough. No more details from our colleagues. Okay. Then another time it come in Malaysia, 2021. That is talk to Jack, father of a 4-year-old Maishara, presented with recurrent cough and wheeze. Okay. Start since 6 months. All relieved by blue MDI and mood chamber. All triggered by upper respiratory tract infections. Mother is a smoker, no features of cystic fibrosis or PID, no history of intubation or PICU admissions. Was not told of particular bug name, child thriving. Father keep asking if it's asthma, predictive index, child had eczema. See doctor with emollient. Parents no asthma. Elder sister viral induced wheeze resolved at 3 year, now 7-year old. So all time it is triggered by upper respiratory tract infections. Then viral induced wheeze and or asthma one come. So recurrent cough, viral induced wheeze, that is. So normally we know that viral induced wheeze is less than 2 years of age old, and asthma is more than 2 years of age old. Normally viral induced wheeze, like main complaints is child has coughing and wheeze, like noisy breathing. So first present illness will take complaint analysis, onset, course and duration. When fast starts, how long is suffering this condition, what is the duration of that. Then what make it better, what make it worse. So make it better, they have given in our history that taking the nebulizer, and it is relieved by the blue nebulizer. Okay. Anything make it worse. So lots of triggering factor, upper respiratory tract infections. It is triggered by, all are triggered by upper respiratory tract infection in our history. Okay, if recurrent, is he normal in between two attacks? Is that sound still to be heard after being well? So if recurrent, it is the, is he normal in between the attacks? That is a very important question, because they differentiate viral induced wheeze and asthma. Is he turned blue? Is it more at night or same all over the day? Describe for me his cough. Is it chesty? Any musical sounds? Can he complete sentences? Does he lose his consciousness? Anyone tested his oxygen saturations? Then fever, weight, activity, sleep, general questions. Ask about previous exposure to triggers like exercise, cold, upper respiratory tract infection, drugs, pets, smoking. Contact with a COVID patient. Ask about atopic march. Runny nose, red eyes, skin eczema, food allergy. Does he look like you and his daddy? Any other concern? Any chronic illness? Again, I am repeating the chief complaint analysis. First, we onset, course and duration. What make it better? What make it worse? Then, if it is recurrent occur, is it normal in between the attacks? Is that sound still to be here after being well? Is he turned blue? Is it more at night or same all over the day? Describe for me his cough. Is it chesty? Any musical sound? Can he complete his sentences? Does he lose his consciousness? Anyone tested his oxygen saturation, fever, weight, activity, sleep result? Ask about previous exposure to triggers like exercise, cold, upper respiratory tract infection, drugs, pets, and smoking. Contact with a COVID patient. Ask about atopic march like runny nose, red eyes, skin eczema, food allergy, like associated with what are this will look like cough. Is there any runny nose, red eyes, skin eczema? We'll ask them. Does he look like you and his daddy, and any other concern, any chronic illness? Then after present illness, we go the systemic review. CVS, awareness of the heartbeat, chest pain, level of activity, fainting attack, any one measure his blood pressure. Then CNS, the abnormal movement, feels, headache, weakness in any part of the body. GIT, poo, tummy pain, tummy size, gastroesophageal reflux disease. GRD also important, vomiting we can ask. MSK, any joint pain, joint swelling, bone ache, skin spots, is it itchy? What is accent? What do you do for that? Does he awake him from sleep? Is there any hypopigment areas in the neck and axilla? A hypopigment area in the neck and axilla because of Addison disease, hair and its distribution, endocrine, urinary, hematology normal. Endocrine, hot and cold intolerance we can ask. Urinary we can ask what about the P. Now past history as usual, 5T IOA, that is past any chronic illness he is suffering. If he is suffering, then when he was diagnosed, any admissions needed, any operation occurring previously, if on a treatment, which team is involving, which treatment he's taking, regularly taking the treatment or not, any traveling history, any trauma. This is 5T IOIA. Then usually recurrent, ask about the hospital admissions, how many times. So it is a recurrent occurrence by induced. How many times did he require oxygen? Any investigation done to him? Any medication given to him? Is he on inhaler? Which one? Who prescribed? How many puffs per day? For how long he is using it? Who gives it to him? Did you sit with the nurse for teaching its proper usage and care. Very important in viral induced wheeze. If you're taking the nebulized inhaler in our task, that is Malaysia, it comes, he's taking the blue and he improved. So we'll take that. Is he in inhaler? Which one first? Then who prescribed that? How many puffs per day he's taking? And how long he's using that? Who gives it to him? Did you sit with the nurse for teaching its proper usage and care? Then prenatal birth stage usual vaccination. Did he receive all these shots? Any extra shot? Any annual shots? Parents receive the COVID shots. Nutrition, breastfeed or formula. Started winning growth chart. Yes, less than 2 years normally viral induced wheeze. But our case the child 4 years of age. So we can keep viral induced wheeze one of the DD in our case. Then family history, describe your family. Any family member has a similar conditions, other allergies in the family, other siblings condition, who take care of the sibling in case of admissions. Home, pets at home, very important. Pets at home, smoking. How about the floors and the laminated or not? Old or new house, radiation of it. Ask about the bed sheets and carpets, to which degree they wash it. Is there a garden? So I'm again repeating, in home, family history of similar conditions. How about the other siblings? Very important. Any allergy in the family? Then home is very important for both viral induced wheeze and asthma history, like pets at home, smoking, floors, are they laminated or not? Old or new house, aeration of it. Ask about the bed sheets and carpet, to which degree they wash it. Is there a garden? School, social is what do you do for living? Is it satisfactory for any family, for the family? Any financial or psychological support do you need? Okay, psychology, social, like impact of the condition on the child and the family. School performance and attendance. Yes, school performance attendance, that is missing school or not. So normally viral induced wheeze, how can we tell differentiation? That is viral induced wheeze on top we will take, like it is associated only during the viral infections. Like our case, 4-year-old Jack, he always occur with the upper respiratory infection following. And but bronchial asthma, that is multiple trigger wheeze, plus minus cold weather, exercise, excitement, pet, smoking, pollens. Remember. And viral induced wheeze, how can we child is other as well? So we'll tell that it is recurrent occur in between the child is well or not. So we can differentiate it. It is a viral induced wheeze. But multiple trigger wheeze or bronchial asthma wheeze, interval symptoms are present between exacerbation, wheeze, cough with activity, excitement, and cold weather. So during excitement, in between attack, the child produce some symptoms. Viral induced wheeze is actually no any personal or family history of atopic disorders present. And by bronchial asthma, what happened? Positive family history of asthma or atopy. And age is commonly less than 2 years or more than 2 years by bronchial asthma. So we can by that we can easily differentiate it. Our case is viral induced wheeze or asthma. And a very common question they ask: what are the DD of viral uh, induced wheeze? Of course, as primary wheeze and secondary wheeze. Primary wheeze, two clinical category: episodic or viral wheeze and multiple trigger wheeze. Episodic or viral wheeze, like wheeze only during viral infection, child otherwise well, usually no personal family history of atopic disorders. Multiple trigger wheeze are already you know that it is with multiple triggers, including viruses, pollens, animals, and other allergens. Interval symptoms are present between exacerbations, wheeze, cough with activity, excitement, cold weather, often a personal or family history of atopic disorders. Secondary wheeze they will ask due to underlying condition with these causes. So wheezing, what are the cause of wheezing? That's there is a very big list. Will tell. Primary we tell already, whether induced wheeze or asthma. And secondary cause are the cystic fibrosis, immunodeficiency, primary ciliary dyskinesia, inhaled foreign body, gastroesophageal reflux disease, anatomical airway problems. Again, I am telling the secondary causes of wheeze are cystic fibrosis, immunodeficiency, primary ciliary dyskinesia, inhaled foreign body, gastroesophageal reflux disease, anatomical airway problems. What are the history in we can ask in secondary, who is like symptoms from first day of life, chronic wet cough, sudden onset of the symptoms, continuous unremitting symptoms, systemic illness. Then physical examination shows difficult clubbing, unusual severe chest deformity, stride or fixed wheeze, or asymmetric signs on auscultation, features of systemic disease. Okay, so these are the cause of wheeze. We'll tell episodic viral induced wheeze, bronchial asthma wheeze, cystic fibrosis, immunodeficiency, spinal ciliary dyskinesia, inhaled foreign body, gastroesophageal reflux disease, and anatomical airway problem. Total 8 cause I told you. Thank you. Yasin, how can we